today I am 1 week post-op my second facial paralysis surgery. So the first facial paralysis surgery I had was back in March, and then this is kind of the second part to that. And as you know, sometimes there's so much intricate things that go on with your face, they can't do everything at once. So last time I had a brow lift, I had the weight taken out of my upper lid, I had the roof of my mouth put into my bottom lid, and then had the bottom lid pulled up. This time I actually had my lashes, both my upper lid and my bottom lid lashes were turning towards my eye, and the bottom lashes were completely in my eye. So I had my lashes, my upper lid and my lower lid, the lashes turned out, and I actually had this part of my eye, they like pulled it up and just completely sealed it, getting rid of that tear duct. And as you can see, it's still red. I think there's still some stitches in there. It's still red, you know, I'm a week post-op, so not bad. It's still a little bit bruised. I also had, I'm pretty sure it was the nerve that I had, the snarl nerve. I can only do it this much now, but it was pulling up a lot on my nose. So I had that cut so it wouldn't be so much movement right there. And it made my nose, when I talk, look a little more symmetrical. And they actually went in through my nose to cut that muscle or that nerve that makes you snarl. So I had that done right there. I also had my frowning nerves right here cut. My mouth now, both ends of my mouth go slightly up, which I like. It made it so when I was talking, it was really pulling down on this side. So now when I talk, it doesn't pull as much. And honestly, it's a little more comfortable to talk when your mouth isn't constantly pulling to the side so much. I thought it was going to be a little restricting, but it is not at all. I think if anything, it looks more symmetrical, and it doesn't feel like I'm pulling so hard to talk. So I am still, and I don't know if you can see it, probably you can, I'm still super swollen down here. Like, this part of my face is still really swollen, and because they cut the nerves, it's still really numb, just kind of all along this area right here. They actually went in through, they made an incision in my chin, and they went in that way to cut the nerves on both sides. And the reason, even though this side is paralyzed, the reason why the doctor cut still this side, even though that nerve doesn't work, was to really make sure it was symmetrical, because sometimes when you cut one, and even though the side is paralyzed and you don't cut the other one, it can kind of give you a little more asymmetry, and he was trying to get them as even as possible. Right now, I have no makeup on, nothing. This is what I look like a week post-op. And so far so good. I'm just gonna wait to heal a little bit, and hopefully I'll be able to show you guys in another week or two a little bit more of like the final results. Thank you so much for watching. Please like and subscribe.